Looks like the YouTube streaming is working.
Yes, I think it is. So I'm going to go ahead and copy that and then close this down. Okay, so that is working. Jackie, I'm going to put the YouTube live stream in the chat if you want to
Okay.
maybe try it and then post it. Okay. All right. So I think we should probably go ahead and get started. Let me get to the screen here. Share and start. Okay. So can everybody see the PowerPoint presentation? Okay. Excellent. Apologies for the technical difficulties. I'm not sure what's going on there. It used to be so easy. Welcome everybody to the weekly update community forum. Paul, you know what? You're the starter guy. Want to get us going? Sorry about that. I'm in automatic mode.
Yeah, just get right into it. Yeah, we'll begin. We always do with the presentation from Pacific County Public Health and Human Services. Lots of slides today, lots of new information. And we will also have a special guest. Once we are done with the slideshow, we'll move on to the question and answer session, which as always, you can post your questions into the Zoom chat box. Trying something new today with a YouTube live stream. We'll see how that works. So we'll have Jackie monitor that. Any questions that might come up through Facebook, people watching the YouTube live stream, it's going to be a little bit unique. But as always with the questions, we ask that you please stay respectful and please stay on topic. We'll do our best to get, however this looks, to get it posted up to PacificCountyCovid19.com and the health department's Facebook page. And that's really it for me. I'm Paul Placater, zooming from the office today. My door's shut, which is why I'm not wearing the mask. The mask is right here for any time I have to leave. I'll kick it over to Katie Lindstrom, Pacific County's Director of Public Health and Human Services. So go ahead, Katie.
All right, thank you. Welcome everybody. And I'm zooming from home today. I have one of my kids is sick, so I'm trying to be extra careful and not in the office today. I also have Stephanie Michael and Kathy Spohr are in the EOC, and they'll be jumping in as well. So we'll go ahead and get started with the agenda. So first up, we will be doing our normal data update by Stephanie, as well as some new COVID guidance. I believe have on the line Gary Preston, who is a guest speaker. He's the infectious control specialist at the Ocean Beach Hospital. So he'll be available to share some information and answer questions about air quality and infection control. There are a considerable number of Safe Start Plan updates that I'll be going over, as well as a school update with a pretty in-depth update on youth sports. We will provide just a little bit more information on some grants and funding and different assistance opportunities, wellness resource, and then we'll wrap it up with a question and answer. So let's go ahead and start off with Stephanie, who will do the data update.
All right, good morning, everyone. As you can see, we're up to 107 confirmed cases. Currently, the public health nurses are tracking 21 active. Of those, 4 are still probable. When we look at the testing data down there, we did a significant almost 300 tests on what we would consider Pacific County residents, and then what's being tested just within healthcare here in the county. That might be other residents like in Grays Harbor or Lewis or elsewhere. We did have a slight increase to our running percent positive, up from 3.3 to 3.5. And then you can see in this past week how we've jumped from basically a 3% positivity to a 5.6 positivity. As of today, our case rate, which is that number we're doing cases per 100,000 population per 14-day rolling average, is just at almost 88 cases. We did peak so far at 124 on October 7th. And so that's where we have had our high peak. We'll see if we continue on this downward trend, which we hope we do, and the impacts that have. So there's kind of just the raw data for everyone. Next one should be our zip code. Most cases coming from, again, both ends of the county, a larger amount up here in the Raymond zip code, and several down in the Long Beach zip code as well. So one note for the zip code map, we had to change the groupings from groups of 5 to groups of 10. So again, don't just look at the colors. Please make sure you look at the key because that got updated this week. Thank you.
Oops.
This is something I just wanted to share. We put it out. Oh yeah, definitions. Again, if you've been on this call weekly, it's always here, but just a reminder of the active, we're monitoring them and they can be either confirmed or a probable that will most likely become a confirmed as that laboratory results come back. The closed, the ones we are no longer following, we don't use recovered because again, we're not tracking beyond really when we're feeling like the public health piece of it is important, yet people are still potentially being impacted on longer term. And then of course, quarantine and isolation, we've been using those words a lot. Quarantine, if you are identified as a close contact and have not yet had a test or been tested positive to become a case. And then isolation, once you have tested positive, you're put into an isolation status. A helpful chart here that we had shared on social media last week and got a lot of reactions to and views. So we wanted to just make sure everybody saw it and had awareness of it as we enter into the cold and flu season, looking across at the types of symptoms and really where they break out amongst allergies, cold, flu, and COVID. Again, the biggest thing here as you start to experience a symptom that's not part of your normal, please make sure you're getting tested as quickly as you can. Next slide. All right, a little bit around some things that have been talked about, super spreaders and super spreader events. This is really looking at if a single person infects a large number of people or if a gathering links a large number of cases together. So we know that it seems like there's some factor of the infection component of someone, right? Based on where they are in the timeline of their incubation period, they may be more infectious, again, towards that beginning when they're not necessarily showing symptoms and then those first few days of symptoms. So they're going to be able to infect potentially more people. We've talked a lot about kind of that R0 value, much more, probably more in the beginning. We haven't discussed it as much, but the idea of like, what is the average number of people a single person will infect? You've heard that we've wanted to have that under 1, right? So if one infected person infects less than 1 person, we're going to have a good downward trend of what that infection spread looks like. Another value, the K value, is something that's been coming out and being talked to, and that really is kind of like, how is the infection spreading? And that is where we see that variability potentially with cases, where some people are just going to have the indication of being a super spreader and potentially cause that variation in spread as we look to it. So just something to be aware of and what's being talked about. Within gatherings and linking large numbers of infection cases there, the biggest thing there is, again, the size of the gathering. As you just put more people together, there's the potential of more infectious people being there and able to spread it to more people. The time, if it's a long gathering, right, we know you're spending more time closer together, all those pieces, again, increases that potential of infection. And then, of course, we know a lot of things around indoors versus outdoors and what the ventilation piece looks like. Those types of things can in fact impact that gathering and how the virus is transmitted. And then lastly, those other things that we continue to push, if they're being applied or not applied, masking, distancing, washing of hands, and those components at a gathering. So again, just something to be aware of when we talk to what might be a person that's a super spreader or super spreader events where those cases can increase. Next slide, please, Katie. Really shifting, especially as we're entering into really the best time of year, all the holidays. We start off with Halloween into Thanksgiving and Christmas, and everybody's getting together. Usually in a normal year, that looks different this year. We're really trying to push the messaging of keeping your gatherings, fewer gatherings, shorter duration of gatherings, smaller gatherings, and be safer at your gatherings. This is a great link down at the bottom of the page to kind of work through some of those logistic pieces and how you would plan for something like this, because this really shouldn't look the same. You shouldn't be having 40 members of your extended family coming over for Thanksgiving dinner. We just know that there is a significant risk in small gatherings, and just, again, bringing people together and not taking proper precautions and how that looks. So again, a good link and what you're kind of looking to do, and planning can really help with that. So emphasizing that piece.
I think an important point on all of this too is that, we are doing a really good job, public health is, as far as when we identify a case, we're very aggressive in identifying contacts, getting those people isolated and tested and those things. And So we really are asking for your help and kind of rejuvenating again around these safety measures that Stephanie just went through. Our case numbers are up there. We all want to move forward with this. We're all tired and want to get back to life, at whatever normal is going to look like. But if we continue in these, increase in cases, it really will jeopardize our ability to keep our schools open, to allow, any kind of athletic events, things like clam digging. All of those things are all dependent on the number of cases that we have in our community. So appreciate all the work that everybody's done to date. That's why we've done as well as we have. But again, as we've seen, the largest increase in number of cases over a short period of time here. Some are related to contacts, but others are just, are showing up, and then we've got, their contacts. So it's going to be really important that people be mindful as we move forward, and, certainly appreciate your support and help pushing that message out and making some of those tough choices that we're going to have to make over the holidays in particular. So thank you everybody for your help so far in that.
And then this was just kind of a reminder, a holdback from the beginning of the month. The Halloween is coming up. There are associated higher risk activities like trick-or-treating or trunk-or-treating, but there's other alternatives that the Department of Health and CDC have put out as options. And of course, with whatever you're doing, please make sure those safety precautions are being followed so that we do really limit any kind of spread potential.
Okay, so and Dr. Preston, I think that's you there. I see you there.
I
So
am.
we didn't have a slides prepared for you, but wanted to give you an opportunity to share what you know and what you'd like to share on the topic of COVID and kind of preventing from that infectious disease kind of spread angle. And then
Sure.
we'll also probably, if you're available, have you still on the line at the end when we do our question and answer. But
Sure,
wanna
happy
give
to
you a
do
chance
that.
to-
And yes,
Thank you.
and I tried to keep these comments brief and in order to assess the type of interest, the questions will guide any future contribution as needed. A couple of quick comments, and most of my comments are in fact quite general, but have to do with the sort of language and terminology that we use. A comment about indoor air quality is that air quality, indoor or out, is determined by temperature, humidity, particulates, volatile organics. And in the old day, or in the recent past, it was, well, let the outside in and indoor air will be improved. Well, not necessarily if you have to keep the smoke out. So what an air standard is an interesting question. And I can provide some website links to CDC and other resources that will help with that. More to the point, and to follow up on your comment regarding the super spreaders, when we have a quote, new infectious agent, quote, we're usually talking about something that, well, we're always talking about something that's not new, it's just newly recognized. And almost invariably, our response causes or stresses not only our societal and cultural systems, but also our technical systems, such that weakness in any one of them becomes clearer. And the list in our memory is not short, from HIV to smallpox, anthrax, H1N1, coronavirus, and so forth. Another important point that others have made in other safety forums is that we don't handle risk very well. That is, in a very logical way. We often think of it as either present or absent, as opposed to more or less. And there's a continuum in these things, and that relates particularly to the mechanics of infectious agent transmission. We in healthcare, infectious disease in particular, have been very sloppy with our language. And all you have to do is plug into any discussion about what airborne means. And it's very clear that even those folks who you would think would have this language down, including me, are struggling to communicate what component or what physical mechanism of transmission we're talking about. Classically, we've thought of agents as being transmitted. They essentially will go as far as you can throw them or carry them. Most of them have to be planted. And there are some that will go, for example, pertussis that causes whooping cough in large droplets, 2, 3, 5 feet. They will go as far as those droplets go. And then on the other end of the spectrum, which we've gotten used to thinking of, as those droplets evaporate and the liquid leaves, dust particles can be attached to, or organisms can be attached to those dust particles, which we refer to as airborne micronuclei, measles or rubeola, varicella, Mycobacterium tuberculosis will go through the air conditioning system, will go through the air and are thought of as being classically airborne. Now, why we discuss those, just as we discuss risk too often as either present or absent, why we thought that there was not a continuum between those large droplet-borne organisms and those we know of as being classically airborne, I can't say. But clearly, as that evaporation occurs, some organisms are more readily transmitted by smaller, as the droplets shrink to aerosols, which we now are beginning, a term we're beginning to use. Some organisms will survive in those smaller particle air droplets or aerosols and be capable of transmission. Appears that COVID-19 is one of them, and that appreciating that continuum is really what we're talking about. In the early days of the discussion of masking, all of us in infectious disease were, well, putting on a mask will not protect you from truly airborne microorganisms. And we were thinking of protecting the wearer. And much of the confusion regarding masking occurred as those in infectious disease, speaking for myself and others who got into this trap, had changed the message or the reason for the message. Well, don't wear a mask to protect yourself. It's very clear, and it always has been, to prevent transmission of truly airborne organisms. Masking the source, the tubercular patient, has always been highly effective. And as it became clearer that masking potential sources of the organism would be effective, the message changed from don't mask to protect the wearer to do mask to protect those exposed to the wearer. The reason for that shift got lost. And it appeared, or there was criticism, continues to be, that, well, you used to tell us not to wear a mask, now you tell us to wear a mask. Well, it's for different reasons, and reasons that are more appreciated, as you just described. So that continuum is better appreciated now. And I think that we're going to have to make sure that we build into our language some precision that we have not had, and that will serve us well. The it's very clear that controlling what goes into the air by masking those infected or known or not, it will minimize the presence of aerosols and availability of organism for transmission to the next potential host. And consequently, being in well-ventilated spaces or it will minimize the presence of organisms as opposed to spaces that are unventilated. But part of that is affected also, as you suggested, by the number of organisms made available from the host, which may be determined by the stage of infection, the status of their immunity, and the notion that there are super shedders is known for every other organism. Staphylococcus, streptococcus, and other organisms. There is always a continuum of high shedding to low shedding, and we should expect or not be surprised that we're finding that to be the case from those infected with COVID-19. So the confusion that we have seen amongst those of us in healthcare about airborne transmission has been, in my view, largely a function of our use of imprecise language, and we need to up our game so that we can make these distinctions and better explain why the interventions we're proposing are likely to be effective, or have been and are being effective. I hope that helps.
Yes, that's very helpful. I really like the idea of talking about all of this sort of on that continuum, because there really is a difference. And I do think people want silver bullets with this. They want to say, well, I'm wearing a mask, there should be no risk. And in reality, it's about multiple strategies layered on top of each other to reduce the risk collectively. And no one strategy is going to really do the trick 100%. I feel like that's a very interesting way to look at it. And especially with the super spreader conversation coming about recently, very interesting.
Yeah. And it also relates to the notion of, well, how do I manage life when we can't stay as a family pod totally isolated? What compromises to that isolation, there's another imprecise use of terms, to that segregation or distancing, should we be prepared to accept? Well, someone in that pod needs to go to work, and enforcing the masking and making sure that where they're working is enforcing the masking affects potential risk. And every time there's a potential breach in that distancing, then those involved need to be intentional in managing how much additional risk they're prepared to allow or tolerate in exchange for opening or communicating with others. And as weddings and funerals and other mutually supportive events come up, we each individually and as families and immediate contacts have to make decisions about what level of opening we can manage and be comfortable with. And that's going to vary, as all these decisions do, it appears.
Yes. Yes, thank you so much. I think the other thing is, if you look at the safe opening plan that has been laid out, it really is taking a lot of that into account, sort of that graduated risk. And also, what do we need to do? What is good for us to be able to do, and kind of weighing it against you could stay home forever, yes, and that would reduce your risk down to almost nothing, but it's not realistic necessarily. So I think when you look at the Safe Start guidelines that have been put out by the state, I think you can really see exactly what you're talking about in those decisions on what has been allowed, what's not allowed, and kind of doing that graduated risk taking.
Yes, I have to say that in all of this, as there have been many kudos for those in healthcare, I think those in education have the biggest challenge of all of us, and more dynamics and uncontrollable circumstances and conditions that have to be somehow accommodated with as much risk mitigation as possible is a massive challenge. And I am attempting to keep up with the decisions being made so that it's possible to chime in support of our educators who are really struggling with the toughest, amongst the toughest jobs on the list, I think.
Yes, our schools are definitely, they have a huge lift right now. They've been doing a great job though, and have been good partners. Thank you, Dr. Preston, for sharing that information. If you are able to stay on, we do question and answer at the end. So if people have questions for Dr. Preston, please get those in the chat, and then we'll get to them after we get through the rest of these slides here.
Sure, thank you.
Yes, thank you. All right, so we'll go ahead and move on here. Like I had mentioned, we do have several updates to the Safe Start Washington phase reopening plan. As a reminder, Pacific County is in phase 3. So I'm just going to share the updates that are relevant to phase 3. I have a lot of things on my screen here. I need to move. Okay, there we go. So first of all, movie theaters, our occupancy has increased to 50% in phase 3. Still need to do the 6-foot social distancing and face coverings while in the movie theater. Restaurants, they've moved the alcohol cutoff to 11 p.m. So it was earlier than that previously. Now alcohol can be served until 11 p.m. in restaurants. The table size has increased from, I think, 5 or 6 up to 8. So table size has increased, and they've eliminated the requirement that everybody sitting at the table be from the same household. Wedding receptions have increased from 30 up to 50. Retail events, think craft sale shows, farmers markets, things like that. They have expanded that miscellaneous venues guidance to allow retail event shows in phase 3 only. They need to be capped at 200 people. Still looking at having those be outdoors, and also mask wearing, distancing, and all of that. Real estate allowing open houses, but limiting it by the county gathering size. Outdoor recreation, so there's some new guidance. It's pretty specific. If you are looking to put on an event like a triathlon or a 5K, there's some new guidance related to that. And also water recreation facilities are now allowed at 50% occupancy. There's been significant updates, and an entire guidance document has been created relating to sports. You can find the whole document down here at this link. But basically, previous to this update, the only guidance on recreation was for adult and community recreation and professional sports. What this guidance did is it updated it to include schools, and it also got just a lot more specific. The gist of it is that counties, so schools are going to be able to allow sports in varying degrees and varying sporting activities. It's going to be primarily based on the county COVID activity level. So that data that Stephanie shares each week, where she shows our case rate per 100,000 over 14 days, whatever the county is in, whichever risk category we're in, either low risk, medium risk, or high risk, it will dictate what kind of sporting activities are allowed and to what extent they are allowed. And I'll share about this here in the next few slides in more detail. So as general guidance, smaller groups are going to be safer than larger groups. Outdoor locations for sports are always going to be better than indoor. Sports that can ensure distance of 6 feet or more are going to be safer than those that require or, have the close contact between the athletes. And then shorter duration is going to be safer than longer. So those are just sort of guiding principles and part of what helped the state kind of determine what is a low, medium, or high risk sporting activity. So some examples here, this is not an exhaustive list, but these are some examples of low risk sports, moderate, and high risk sports. Low risk are tennis, swimming, pickleball, golf, cross country, track and field, sideline, no contact cheer and dance, and disc golf. And what you can see what's similar about those sporting activities, they all are outdoor sporting activities. They all are typically either individual sports or just limited, maybe two people playing against each other, like in tennis. Ability with some of them, like golf, to continue to wear masks. Moderate risk sports, softball, baseball, t-ball, soccer, wrestling, volleyball, not wrestling, volleyball, lacrosse, flag football, ultimate frisbee, ice hockey, cricket, gymnastics, crew, field hockey, school bowling competitions. And then the high risk sports, and again, these are going to be likely either indoor or a lot of physical contact between the players, long games, those kind of things. So we're looking at football, rugby, wrestling, cheerleading with contact, dance with contact, basketball, water polo, martial arts competitions, and roller derby. Again, not an exhaustive list, but you can kind of take those principles and apply it to a sport that's not listed here to help kind of determine which risk category that sport may fall into. So I had mentioned, so there's kind of the two components. The first is the sport low, medium, or high risk? And then the second component is the county in which that sport is going to be played. Are they low, medium, or high risk in terms of the county COVID case rate? So a high level county would be a county that has greater than 75 cases per 100,000 over the last 14 days, or a county where the test positivity rate is greater than 5%. This is where we are currently at. We are, I believe we're at 97 per 100,000 currently, or maybe just below that. 87. So this is where we are currently at. So these would be the guidelines that would apply to any of the sports that are allowed. So you could have team practices or training can resume for low, medium, and high risk sports. So just practices and training, but the groups have to be limited to 6 or fewer. And it is preferable that those groups of 6 or fewer are stable over time, meaning that the same 6 group of kids are playing together all week or practicing together all week, and you're not intermixing kids kind of throughout the week. Encouraging that any practice or training that can be done outdoors should be done outdoors. All leagues, sporting teams, regardless of activity level, have to publish and follow a return to play safety plan. And I'll go over what is required in those plans after we get through these couple slides here. In the high risk category, scrimmage, intra-team competitions, and league games are allowed for low risk sports only, but they would be discouraged if the school is not conducting in-person learning for that age range. No tournaments are allowed, no spectators allowed except for one parent guardian for each minor aged participant, and then no spectators if the participants are over 18 years old. And then also the distancing with spectators needs to be maintained, as well as mask wearing. Now, if the county is in the moderate risk category, which would mean the case rate of between 25 and 75 cases per 100,000, then we would still require the health and safety plan from each of the teams or the leagues. We would encourage outdoor versus indoor. The difference between high and moderate is that scrimmage, intra-team competitions, and league games would be allowed for both low and moderate risk sports, whereas in the high risk category, we're just looking at allowing the low risk sports. Still no tournaments allowed, same requirements around spectators. So just one per minor participant, and then no spectators for over 18. And then again, mask wearing, 6-foot distancing. The other important thing to note is the league or the team needs to keep accurate attendance rosters to include contact information. And that's just in case a positive case were to happen to assist public health with the contact tracing efforts. So the next category is if the county is in the low level COVID activity, which would be fewer than 25 cases per 100,000 over 14 days. Similar health and safety requirements required, but this is a point where we can actually allow scrimmage, intra-team competitions, and league games for low, moderate, and high-risk sports. Tournaments would be allowed. However, any of the teams attending those tournaments would need to be from counties that were also in a low-risk COVID category. And then spectators would be expected to follow the current gathering size limit in the Safe Start plan, and then also the mask wearing and distancing. So that is kind of what is allowed based on that COVID case rate. I'd mentioned that each team or league would need to publish and follow a safe return to play plan. These are the components that are required in that plan. I'm going to go through this quickly, just hitting the highlights because this is about 4 slides. There's a lot of stuff required. First of all, we want to make sure that the plan requires people stay home if they're sick or if they've been in close contact with anyone with COVID. All coaches, students, and any other participants must be screened for signs and symptoms of COVID prior to a workout or a game. Masks are required for all athletes, participants, directly before and directly after sporting activities, and then strongly encouraged whenever not in strenuous activity. Spectators need to wear them all the time, coaches all the time. The athletes may take them off just during the actual physical activity of the sport if it's strenuous. Again, spectators must wear facial coverings. Distancing needs to be maintained. Obviously, practicing good hygiene, including washing of hands frequently. The league or the team should provide hand washing stations or other means to sanitize hands and encourage that to happen frequently. Let's see, use of locker rooms should be limited, discouraging use of showers because of that potential for that aerosolized virus. If the locker rooms need to be used, then they need to be maintaining distancing in the locker rooms, considering staggering entry to the changing area so that there are not a lot of people kind of crowded or gathering in one area. And then, of course, increased cleaning in the locker room areas and also of any sporting equipment between uses. More information. So ventilation is going to be really important. Again, outdoor is better than indoor. Or if you're indoor, have windows and doors open. Limiting exposure during any travel to the games. So avoiding buses if possible. Encourage families to ride together. If people are on the bus, they need to be wearing a mask. There should be efforts to distance athletes on the bus. Again, the plan is going to need to have detail how that organization is going to keep records for contact tracing. And then finally, the as employers, so school districts are employers of the coaches. They also need to ensure that they're maintaining all health and safety standards set forth through Labor and Industries, L&I, because again, they're obligated to create and provide a safe work environment for coaches. So that's the really quick and dirty sporting guidance. We are going to be meeting with our athletic directors tomorrow to go over all of that in a lot more detail. We're also going to have our public health officer on to answer questions. So more information, I would imagine, will be coming out soon from whatever school you may be following or have a student at. So wanted to kind of go through now, separately from sports, what happens if there's a positive case in school? So first of all, public health would be notified of the positive case. Typically, we get the results directly from the lab who conducted the test. So we typically know first. It's plausible that we could have a student who lives out of county, let's say at Nasell or something, and they live in Wahkiakum County. So in theory, it's possible the student or the school or another county may be notifying us of the positive case. But bottom line, public health is notified one way or another. We immediately instruct the positive case to isolate for a minimum of 10 days. It could be longer, depending on if they have symptoms and how long those last. And then we begin our case investigation immediately, which includes, if the school doesn't already know, notification to the school. Public health then requests a list of all potential contacts that student or staff could have potentially come in contact during the infectious period. We send, the school sends a letter notifying parents that there was a positive case in the school. The school provides the list of potential contacts to public health. We then take those potential contacts and reach out and do interviews with all of the potential contacts to determine if those students or staff are actually going to be classified as close contacts. And then anyone who is a close contact is tested and quarantined for 14 days. And then, of course, we, on an ongoing basis, we monitor positive cases and close contacts. The reason we kind of wanted to go through this is because if there's a case in school, parents are going to be notified generally that there was a case in school, but unless you're notified by public health and interviewed as a potential close contact and told that you are a close contact, then you're not a close contact. We do not notify the public health does not notify every single student or staff who was potentially in the school with that student during their infectious period. We're just whittling it down to those students and staff who actually had a potential exposure. So that's just kind of an important thing to note there, and why we don't call and have everyone who is at the school become a close contact.
Hey, Katie, the other thing to add there too, that I think sometimes people get a little bit confused about is if you've been identified as a close contact, you need to quarantine for that 14 days, regardless of what your test results are. So we ask that you get tested, go get tested, you get a negative result. You still need to quarantine, stay away from everybody for 14 days because you could be incubating and not have come across as positive when you're actually tested. So that 14 days is really critical that people, it's difficult to do. It's 2 weeks of, really kind of staying away from everybody and quarantine, but it's critical to us maintaining, and not further spreading the disease.
Thanks,
Gary Preston here. I would just reiterate that and support that. We run into that. And it's important to underscore that test result only tells you the status that day. And for the balance of the incubation period, the quarantine has to continue. It's a very important point.
Yes, very, very good. Our understanding is the majority of people are going to test positive kind of in the middle of their potential incubation, but it could be 14 days or even longer before you test positive. So very good point. Thank you guys both. All right. So, so we had talked about the school will provide a list of all potential contacts to the health department. Who's included in that potential contact list? It's going to be anyone who was on the bus with that student, so the driver or other students, anyone who was in the classroom with that student, students and teachers, lunchroom contacts, playground contacts, and then anyone else that you can identify who was around that student or staff closer than 6 feet for more than 15 minutes. That's really important to note. Not all potential contacts actually become close contacts. So this slide here kind of gives a general idea of who would typically become a close contact. Due to the duration, anyone who is in a classroom with a positive case all day, so like an elementary student where they spend 6 or 7 hours together all day, even if they're masked and distancing, because we're trying to be extra cautious with our schools, those are going to be considered a close contact and quarantined. Now, in a middle high school setting where the students typically rotate around and they're not sharing an enclosed classroom with other students for 6 hours, those students are not automatically going to be close contacts unless we can identify that they were actually closer together than 6 feet for greater than 15 minutes. And then also the same thing is true on a case-by-case basis for buses, lunchroom, and playgrounds. So an example is if you have a student who rides the bus and it takes them 20 minutes to get home, other students who are around that bus around that student within 6 feet on the bus are going to be close contacts because they would have had that closer than 6 feet for greater than 15-minute exposure. But if you have a student who is a positive case and they sat at the very front of the bus, and then you have another student who sat at the very back of the bus, the student at the back of the bus would likely not be a close contact because they didn't have that proximity. And then, of course, again, anyone else who's identified as having been closer than 6 feet, 15 minutes is going to be a close contact. So this isn't hard and fast. There are going to be other extenuating circumstances, and every case is unique and kind of has to be worked through individually. But this is a good sort of general overview of who would be considered a close contact in a school setting. And again, close contacts would be the individuals who then would be instructed to quarantine for 14 days and potentially go and get a test. this, we previously had shared sort of a decision tree on how to know when you should send your student to school or not to school, depending on how they answer the attestation form each day. It looked in a different format, and I think we'll try and get this information into that same format in an updated document for people to use. But there was a change to one of the categories on that decision tree, and that was for people who, so either a student or staff who has had a COVID symptom. Previously, if they had a COVID symptom, they were going to have to stay out of school for the 14-day period unless they were able to, even if they got better, unless they were able to come back and show that they had a negative COVID test. That has now been changed slightly. They've divided the COVID symptoms into two different types of symptom groups. You have the Class A symptoms, which are the most likely COVID symptoms, and then the Class B COVID symptoms, which are still COVID symptoms, but just slightly less common. Or slightly less common in determining that someone actually has COVID. So if a student has one of the symptoms from Class B list over here, so let's say they have a headache on Tuesday, they're going to be able to go back to school now once that headache resolves without medication and 24 hours has passed, even if they don't have a negative COVID test result. Now, again, they cannot have had exposure to somebody who was positive with COVID. In that case, they're automatically quarantined. But this just sort of kind of lightens up the expectation, gets kids back to school a little bit faster. If it's one of these Class B symptoms, it's going to make it so they are not going to be required to go get that test to prove that they don't have COVID before they can come back. So we will get this put into that chart, and so it's a little bit easier to understand, but we did want to share this new guidance just came out yesterday. Stephanie's already talked about this. Our COVID activity level is greater than 75 per 100,000. We've been in that range for about a week now. If we stay in that range for another 2 weeks, for a total of 3 weeks in the high risk category, we would be looking at changing our recommendation to schools around in-person learning. Currently, all of our schools, except for North River, are doing in-person learning for elementary students. And several of the schools are in person with middle and high school. And if not currently, then they will be within the next week or two. Again, this is just that case rate per 100,000 over 14 days. This just shows the trend of where we've been at since the beginning. This is March over here and then up through current. So you can kind of see we are in that red range, which is the high risk range. This is not where we want to be. We're very hopeful that it continues to go down back into moderate and low risk. All right, who would like to talk about this? Paul, Jamie?
Yeah, I can jump in on that.
Okay.
So the county is still accepting grant applications from small businesses and nonprofit organizations that were affected by COVID-19. The grants are up to $10,000. And again, they're not loans, they're grants. They don't have to be paid back. So we have gotten a couple questions about that. There's been so many funding opportunities that were not grants, were loan-based. It's not what this is. These are grants straight from the county. We're taking applications for these CARES grants through this coming Friday. We have to have them in hand by noon this Friday. So if you yourself are a small business owner, if you know someone involved either with a small business with 20 or fewer employees who are affected by COVID-19, or if you're a nonprofit organization, we need to have them down here. You can certainly email them to me if you have a question about it. My email address is in the press release. That link for the press release is listed right there in blue. I don't think we have a slide for it, but I did want to point out that the city of Raymond also has some funding opportunities for small businesses within the city limits of Raymond. And you can find that information on the city's website. As you can see on the page, there are multiple other funding opportunities for various people, entities. CARES Act for healthcare providers, youth development, Washington Arts Commission is offering funding. There are links to each of those potential funding opportunities on this slide. And of course, this slide and all of the information that Katie had covered, there's a lot today. That slide deck will be available on PacificCountyCovid19.com. So all of this will be available there.
For the city of South Bend too, they have a program where they're providing some assistance to city residents for utility assistance. So you could check the city's website there for that as well.
Thanks, Kath. And we continue to have the eviction rental assistance program. I know that we're getting a lot of applicants for that and getting a lot of rents paid, but we still have funding there as well. All right. Oh, look at that. So this is just kind of overview of the eviction rental assistance program. And then also coming up soon, we have the emergency solutions grant. So this is for emergency shelter, rental assistance, utility assistance. So again, contact the health department via that email address there, rentassistance@co.pacific.wa.us for more information about those programs. All right, back to school. This is sort of our mental wellness reminder for the week with kids coming back to school. Just reminding everybody that this has been an incredibly stressful year for, I think, all of us. But it also, sometimes I think kids get lost in the shuffle a little bit. And so it's just really important to remember that they're also going through kind of this collective traumatic pandemic event with everybody else. Don't always have all of the same information that we have, which can lead to unnecessary worry. So just reminder to check in with kids, give them reassurance, provide practical help kids develop a routine. And this is whether they're back in school or not. And then also just being a role model, role modeling healthy ways to manage stress. And to handle all of the changes that have been coming at us all year. All right, useful links. I don't think there's anything updated here, but just for reference, our next community forum is going to be October 28th at 11:30. A reminder, this is a bi-weekly forum now instead of weekly. Same link, same meeting ID and all of the other information. And with that, I think we're done with the presentation. I know we went a little bit long, but we have some time to take questions.
Yeah, and we'll try and get through all the questions in the chat box here. We're not just going to cut it off at 12:30. So starting at the very top here, just got a call from Pacific County for the test tomorrow and a follow-up from Emergency Management Director Scott McDougall. We've actually delivered 16,000 phone calls in 20 minutes and we'll deliver a grand total of 22,000 messages for this test. Can we speak to exactly what that test is?
Is this a question for Scott?
I believe that the question is for Scott here, if he's on the line. You're muted.
Scott
over.
is muted.
Can you hear me now?
There
Yes.
you go.
The Great Shakeout takes place tomorrow. As part of the Great Shakeout, we are going to test the AHAB sirens with the actual AHAB siren wail. In order to keep the community informed and to ensure that we have an adequate amount of warning for people, we test the all hazard or the emergency notification system, the reverse 911 system, the day before to provide a message that everybody is going to hear the wail, or at least everybody who's within the earshot of the sirens. If you don't hear a siren, that's okay. It's only intended as an outdoor warning. It is not intended, nor has it ever been intended, to be an indoor warning. It's something to warn people who are actually on the beach. So we will be testing the AHAB sirens at 10:15 tomorrow. It will be the actual wail. And that's what the ENS test was about today.
Thanks, Scott.
Yeah, thank you.
All right.
So that looks like zip code data related proximity type of questions. Kind of frightening that we had 12 cases recorded yesterday, according to the Smart News app. Since there are so many, can you let us know what parts of Pacific County these people are located? And I think that goes back to that.
So, yeah, so we can't release zip codes with individual cases. We can tell you that there are cases in all parts of the county. There are cases in North County, there are cases in South County. And we can also tell you that's consistently generally been the case the entire time. We can't release individual zip codes with individual cases due to HIPAA laws, and we're a very small county and our population just doesn't allow for that. But just know, it's never just been in one part of the county. It is consistently and always been in North County and South County. So we just really advise people to act as if it's where you're going. Wear your mask, distance. We're not saying those things just to be, fun killers. COVID is everywhere. It's all throughout Pacific County, and that's currently the case as well.
And I think that really speaks to the question down below that Nansen had similar thematically. So I believe Katie kind of covered the gist of that. Then there was a question immediately answered here about the number for gatherings indoors and outdoors, which was covered in the slide deck, which again, PacificCountyCovid19.com for everybody to go back and take a look at that. We'll have the slide deck up shortly. School related question. With the increase in cases, are you still recommending the schools start next week as planned? High school at Valley was postponed for a week.
Are you still recommending schools start next week? So our recommendations regarding schools returning to in-person instruction has not changed. It would change again if we stay in that high risk category for a 3-week period. That's the point at which our recommendation would change. We're trying not to change our recommendation just when the data blips up and down, because that would be a constant. We'd be doing like 2 or 3 recommendations a week if we went, just every single time it dipped up or dipped down. That's why we're looking at a sustained 3-week period of the high risk category before we make a recommendation to tighten things back up and potentially go back to online learning.
Okay.
The other thing with that to keep in mind is as public health makes the recommendation, then it's up to the school board and their administration to actually make the decision whether or not they're going to make a change in what they, either how they're operating currently or what their plan is to bring students back. So it's a public health recommendation, and they have the final say in that.
Okay. It's like the next question, speaking to risk and that continuum of risk. I think things would be different and better, worse otherwise if we in Pacific County were like other states with more people who do get COVID, suffer the effects of it as well as die. And we've been fortunate we haven't seen that as much here, but would that risk be any different, I suppose, is the general question here.
So is this the question? Would you think the risks as good
Yes.
if we were like other states? I'm not sure I understand the question.
From my perspective, I think the risk is the risk. The outcome, is dependent on a number of things as far as people who actually contract COVID and what type of outcome that they have. And again, it's as far as what we know about this particular virus, we don't know a lot about what kind of long-term impacts this may have. So the risks are the risks. Generally, unfortunately, if we had a lot of deaths or those kind of things, some people might pay closer attention to those risks. But as far as the risks themselves, I don't think that changes.
Yeah. And we have, we have had 3 deaths in our county out of about 100 cases. And I think we've had the entire spectrum of people who were almost completely asymptomatic, all the way to people who got really sick and hospitalized. And again, the 3 deaths. So we've really had that whole spectrum of types of cases that you hear about.
All right. And here we have a question for Dr. Preston. Can you speak to safe airflow in businesses, for example, restaurants and bars, as temperatures reduce? Can fans that pull air up and out of restaurants and bars that were previously used to move smoke out carry away COVID aerosols? Does keeping doors open assist with this?
Yes, I heard in the question, would those mechanics provide safety? And the question is, compared to what? Compared to not being there, no. And that's the challenge of weighing these risks. So you have a restaurant. I don't know if you can see my screen or not. Typical configuration here. So you're here in the restaurant. If you're the only group there, that is probably the bigger determinant. Usually, so the air is pulled from the space. Some of it goes out. Some air comes in. It mixes with that portion that isn't sent out, is mixed humidified, heated, and then supplied. So the question is, you're never going to know what their arrangement is. How much are they sending out versus recirculating? And furthermore, the fact that you are in the space with a server who's masked, but that's adds more than you would face if you were taking your food home, having picked it up at the door. And then the table next to you, which is now as many as 6 people, are in mask respite because they perceive that they're in an eating space. So the masks are off, and it happens to be in an occasion and we're singing happy birthday. So it's a matter of how much additional risk is worth the fellowship gained by being in the restaurant. And people have to determine that on their own. I mean, if you look at the eating space and eating as putting food in, then maybe the mask should be on, except for as the fork goes in people's mouths. On the other hand, I'm sure that most folks don't think of their restaurant experience being that. And the question is, how much additional risk are you willing to assume by being in that space in uncontrolled circumstances than you would be if you weren't? And again, it's not a matter of safe or not. It's a matter of how much additional risk would there be, and is it tolerable or acceptable or not? How's that for not answering the question yes or no?
Very helpful information, one way or the other.
Yeah, it is. Each of these decisions involve that weighing of risk, more or less, and all of us are faced with it. I mean, we have had a wedding in the family over the summer, and it had to be small. The ceremony not attended by half a dozen or fewer people, and tables spaced 12 feet, everyone masked the entire time. And it was brief and to the point, but it was an occasion that we needed to accommodate. And every family has to deal with that. And there was only one couple in from not the pod, if you will, and the mask reminder had to be made once, and somewhat forcefully. And I totally understand the dynamics that have to be navigated, but there is no alternative. But trying to, and it worked all well. Everyone understood, and that was fortunate for us. But and many other lives, especially those with school-age children and jobs that need to that require presence in a workspace, complicate this orders of magnitude greater than some of us have to navigate. And trying to be supportive of those who have those dynamics to have to navigate is something we're going to all need to get better at.
Absolutely true. Let's see, we have a couple more questions here.
I don't know how to give the screen back. Oh,
There you go. I did it.
All right. In this most recent increase of cases, how many were connected to other cases? How many different clusters were there?
Yeah, a significant number. Obviously, we had cases that popped up. We quickly asked for those close contacts to test, and then they tested positive as part of that kind of a household cluster. With that, there was also, like, we're talking cross connection too a little bit. So again, just understanding how we get to those close contacts as fast as we can and get them tested and quarantined to make sure that we contain it as fast as we can.
Stephanie, how many were just truly isolated, just one case?
I don't think any, in all honesty.
Yeah.
Yeah, out of the last week, no. And it kind of, and we can feel it in public health, right? The amount of close contacts, our lists are increasing. More towards the beginning of this, we'd call somebody, they'd say, oh, no worries, this is what I've been doing. And we'd maybe get a close contact, right? Their spouse or something like that. Now we're getting up 10s, 15 lists of close contacts because people are out and moving about. And again, we're feeling it on our side for sure.
Absolutely.
Yeah.
And that really is why we put in the requirements with the schools and all the different locations around distancing and mask wearing, because those interventions, when layered, really reduce the risk. And it also reduces the number of close contacts that we're going to have to investigate, because we see it. It translates. I mean, it's a domino effect, right? So we really need people to remain vigilant.
Yeah, the same advice from the very beginning of this is going to continue to be the same advice throughout the duration of this, however long it's going to last. And again, for everyone to check out the chat box here, Stephanie posted a lot of information about COVID-19 case zip code data. And again, PacificCountyCovid19.com is where you want to go to check out all of this information.
And for the people listening who can't see the chat, so we are in the high risk category, 87 cases per 100,000.
Yeah, the meter ticked over into the red this time. I think we covered all of the questions. We bounced around a little bit, tried to stay on topic with everything. Just want to make sure I didn't miss anything here. We've gone a little long, but we had a pretty long presentation today. So there's a lot of information to cover for sure.
Anything
Again,
from Facebook? Did we check in with Jackie?
Yeah, let's check in here. Jackie, did you have anything? Facebook, YouTube?
I don't have anything on YouTube, and I am checking Facebook, and there doesn't seem to be any questions on our last post.
Okay.
There's a pretty significant lag with YouTube. Hopefully we can get this, the tech difficulties with Facebook worked out for next week.
Yeah. But thank you to everybody for joining in. Thanks to Dr. Preston for taking the time.
Oh, you bet. Useful for me as well. Thank you.
And obviously, thanks to Katie, Stephanie, everybody in public health for doing what you do and continue to do.
All right.
Shout out to the nurses.
Yeah.
They're doing the
Yeah.
heavy lift, guys.
Yeah.
Like they are lifting heavy right now. So really thank you all.
Yeah. Leah, Amanda, everybody, what they're doing. It's
Lori.
a lot.
Yeah.
Lori.
Lori, it's Lori.
It's Lori.
Is there any relief for the cost of testing? Insurance, if you have insurance, Medicaid or Medicare, you should be fully covered. And for people who are uninsured, there is a HRSA program to be able to help with uninsured costs. So testing should not be costing people money. I will say the caveat is if you're just going, you have no symptoms, you weren't tied to a case, that might not be the case. So if you're symptomatic or if you were tied to, you were a close contact with somebody who had tested positive, there shouldn't be a cost to testing. How do you find the information for people without insurance? So the hospital or the place you're getting tested should have that information. If you're not able to get it that way, call us at the EOC and we can help you navigate that. So 875-9407, Monday through Friday, 8 to 4. All right, it looks like that is the last of the questions. So I think we'll go ahead and wrap up for the day. We'll see everybody again on the 28th. Thanks everyone again for joining us for a slightly longer than usual community forum. We really appreciate you guys spending the time with us. Have a good day, everyone.
Thank you.
Bye.
Thank you.